hypertension. The normal pressure at the pulmonary artery is 25/8. Hypoxemia causes pulmonary vasoconstriction.
The heart is a beating muscle that pumps oxygenated blood to the entire body. After leaving the heart, blood must first pass through the lungs to receive oxygen before it can go to the body cells. In order for blood to move from the heart to the lungs, blood must travel through the pulmonary artery and then into smaller and smaller vessels of the lungs. The diameter or tone of these blood vessels is regulated by a substance called endothelium, which circulates in the bloodstream. A condition called pulmonary hypertension is marked by a large increase in the amount of circulating endothelium, causing the small arteries of the lungs to narrow. When the arteries of the lung become narrowed, increased resistance to blood flow develops, thereby necessitating the heart to work harder to pump blood to the lungs. At the same time, the lungs work harder to bring more oxygen into the body. This condition causes the blood pressure in the arteries of the lungs to become abnormally high. Because the heart has to work harder to pump blood, the right side of the heart may become abnormally enlarged and heart failure can develop.
Causes of pulmonary hypertension. It can be idiopathic COPD or obstructive disease, lung fibrosis, pulmonary embolism, left heart failure, or pulmonary Eisenmenger syndrome. Symptoms: dyspnea, syncope, chest pain, elevation of the SON2.
Pulmonary hypertension and cor pulmonale. Pulmonary hypertension is an abnormally high blood pressure in the arteries of the lungs. It can occur as a primary disease or as a secondary complication from an existing disease. Primary pulmonary hypertension is a severe and progressive disease. It is characterized by an increase in pulmonary arterial pressure. It is common in women than men and could be fatal in a few years if left untreated. Secondary pulmonary hypertension can develop as a result of a cardiac or pulmonary diseases or both. The origin of primary pulmonary hypertension is unknown. However, it was discovered that the key mechanism involved in this disorder is a deficient release of vasodilator mediators from the pulmonary epithelium, with a resulting cascade of injury. The three elements that combine to cause the increased vascular resistance are vasoconstriction, remodeling of the walls of the pulmonary vessels, and thrombosis. Secondary pulmonary hypertension occurs when a primary disease causes a chronic increase in pulmonary artery pressures. Such diseases included congenital heart defects, other cardiopulmonary disorders, or connective tissue disorders. Classic symptoms of pulmonary hypertension are dyspnea on exertion and fatigue, exertional chest pain, systolic ejection murmur, dizziness, and exertion.
Diagnosis. The best initial test is chest X-ray, EKG, echocardiography are other methods of diagnosis.
The American Society of Echocardiography's new DVD on transthoracic echocardiography is entitled How to Perform a Transthoracic Echocardiographic Study, Volume 1, Transducer Position and Anatomy. This DVD includes a 30-minute instructional video and an interactive section for flexible presentations. The video includes an overview of relevant cardiac anatomy, step-by-step presentation of all transducer positions, and the sequential transducer movements to acquire standard echo images needed to complete a transthoracic echocardiographic study. The cardiac anatomy section visualizes relationships of the heart, ribs, axis of the heart, planes of the heart and aorta, chambers, valves and annuli, and blood flow through the heart. The transducer position menu allows the user to view the anatomical landmarks and the transducer positions for left parasternal, apical, subcostal, and suprasternal image acquisition. The Views and Imaging menu allows the user to navigate from a particular transducer position menu, such as left parasternal long, to specific images acquired within that window, such as PLAX high depth, PLAX low depth, and PLAX zoom of the aortic and mitral valves. Each animated loop shows a finder image in the upper left and the echo image.
This video shows an echocardiography of the heart to see the pressure of the pulmonary artery.
With labels on the right. Please enjoy this clip from the DVD and be sure to visit asemarketplace.com for more information. The first view is simply called the parasternal long view. To acquire this view, the transducer indicator is aimed to face the patient's right.
The most accurate is the Swan-Ganz catheter. Treatment: prostacyclins analogs and endothelin antagonists. Thank you.